Hi, everyone, and welcome to episode 92 of the Pet Behavior Chat. And today we're going to be chatting about something which is quite cool and very, very interesting. And that is the correlation between pica and GI disease in dogs and cats. So for those of you who are unfamiliar with the term pica, pica is basically the ingestion of non-food items, and is something that, from a behavioral perspective at least, is kind of grouped under the umbrella of abnormal repetitive behaviors, which are also sometimes known as compulsive behaviors. But I think abnormal repetitive behaviors is probably the better term for it these days. Now, there has been quite a lot of discussion around, and some previous research, some previous studies on whether this behavior, so ingestion of non-food items, is actually related or correlated with gastrointestinal disease in dogs and cats. And we've had a couple of papers that have looked at this. One of them, for example, was looking at excessive licking of surfaces. So not actual pica behavior, but orally motivated behavior towards non-food items, and found a correlation with sort of different forms of GI disease or different causes of GI disease. Now, the reason that I wanted to talk about this today is twofold. Number one, because over the past few weeks, for whatever reason, we have had quite a few foreign body surgeries at my clinic in Abu Dhabi, both in dogs and cats. And also because recently, a couple of months ago, a paper came out in JAVMA, which is the Journal of the American Veterinary Medical Association, looking at pica as a clinical sign of chronic enteropathy in dogs and cats. And I want to chat a little bit more about that paper and what they found. But basically the fact that we had so many foreign body surgeries in the last couple of months, and then this paper coming out, has actually caused us to rethink our protocols at my clinic when it comes to patients presenting for foreign bodies. So now whenever we do have a foreign body surgery, and we go in either with endoscopy or laparoscopically, we actually take at that time biopsies. So both gastric biopsies and intestinal biopsies, so both. Because, as you're going to see in a second when we talk about the paper, there is strong evidence to suggest that there may be underlying chronic gastrointestinal disease in these pica cases, which often result in foreign body ingestion and the need for foreign body surgeries. And it's just kind of helped us in terms of our workup. How can we prevent these patients from representing? So how can we make sure that they're not back, 6, 8, 9 months later with another foreign body? But also, how can we address potential underlying gastrointestinal disease? So that's really been sort of the catalyst for this episode today. And I just wanted to go through the paper and also think about what could be other reasons for patients ingesting non-food items. So I think the first question we need to ask ourselves is it ever normal? Is it ever normal for an animal to ingest a non-food item? And I think there's probably only one sort of thing that I can think of here, and that would be normal exploratory behavior in young or juvenile animals. So we all know those kittens or young cats that have swallowed a fish hook because they've been playing with a string that was attached to the fish hook. Linear foreign bodies in cats is a classic example of sort of play behavior that then leads to ingestion. But as I was thinking about it, I couldn't really think of too much else that would be considered normal when it comes to ingestion of non-food items. The other thing that sort of came to my mind was maybe a young, large breed dog that had maybe outgrown their mini Kong. Maybe they had a tiny or a small Kong when they were puppies, and as they've grown, they're still playing with the Kong, and all of a sudden they're mouthing, and then they're swallowing that Kong. So those are sort of the scenarios that I thought of where it might be, in inverted commas, normal from a behavioral point of view, leading to accidental ingestion of something. But I think everything else is either a physical health abnormality or perhaps a behavioral health abnormality. And if we're thinking of physical health, then obviously GI is the big one. That's what we're going to be talking about today. But there are a couple of other instances that we might also think about ingestion of non-food items. So those being anemia is one of the big ones, and the second one is pregnancy. And that is somewhat related with nutritional deficiencies. So iron deficiencies are noted in the case of anemia, and perhaps during pregnancy, there might be other nutritional deficiencies, and the animal is trying to get those by ingesting objects. Now, geophagia is also something that sort of popped into my mind as I was thinking about this. We certainly hear about this in horses, related to nutritional deficiencies, potentially also in dogs and cats. And that's also sometimes to do with nutritional deficiencies. So that's something to bear in mind as well. You know, what is it that they're actually ingesting? Is it earth? Is it soil, as in the case of geophagia, or are they other items? So the ones that we most commonly see would be rubber, plastic, foam. Those are sort of the materials that we tend to see a lot of, certainly here in the UAE, when it comes to foreign body material ingestion. And then, of course, sometimes there are, you know, bits of toys that might relate to this normal exploratory or play behavior gone wrong. Okay, so let's have a look at this paper, which I thought was just super interesting and I guess a little bit validating from the point of, I think we always tend to think about GI disease when we have pica behaviors. And I guess just to sort of caveat what is different from normal exploratory or play behavior is that pica is this abnormal repetitive behavior. So the animal is highly motivated, highly driven to find sometimes certain material type objects, you know, absolutely that rubber, plastic, foam is classic there. They're highly motivated, they seek it out, and when they find it, they will chew on it and they will oftentimes ingest it. So it does, if it's a behaviorally abnormal behavior, it does sit under that umbrella of abnormal repetitive behaviors, which are highly motivated, often repeated, and will spend large parts of their day engaged in these behaviors or seeking to engage in these behaviors if we're managing the environment well. So I think that's a little bit the difference between, well, what is normal play behavior gone wrong and what is actually, from a behavioral perspective, an abnormal behavior. Now, then comes the question of why do these animals with GI disease, why would they want to ingest non-food items? Surely that would make them feel even worse. But I think the thought process here is that these animals with chronic GI disease feel uncomfortable, painful. We all know how uncomfortable GI, distension or chronic GI disease can be. And the thought process here is that they ingest non-food items in order to relieve that pain and or discomfort. Okay, so now let's really look at the paper. So this is from a group out of Arizona, and it's a retrospective study or retrospective review. So they basically looked at 133 client-owned dogs and cats that were presented to this multi-specialty hospital, so it's a Blue Pearl hospital in the US, for endoscopic gastric foreign body retrieval. And the time frame was quite large, so between January 2018 and August 2024, so sort of in this kind of 5.5 year time frame. No, sorry, it's even longer than that, 6.5 year time frame. They found 133 of these client-owned dogs and cats that had endoscopic foreign body retrieval. Now, of these animals, they took 122 and they divided those into 81 animals that were not biopsied at the time of foreign body retrieval, and then 41 that did receive gastrointestinal, so not just gastric, but gastrointestinal biopsies at the time of foreign body retrieval. So we've got about 2/3 that were not biopsied and 1/3 that were biopsied. And the animals were also screened for anemia, pregnancy, and they only chose animals that were under 2 years of age. In fact, the mean age was 8 years in dogs in this retrospective study and 6 years in cats. So they looked at adult animals that were perhaps less likely to sort of present for this accidental toy ingestion type behavior. And then they looked at the biopsies of the 41 animals that were biopsied, and they found some super interesting things, which are 100%. So all 41 of the 41 biopsied animals had chronic gastrointestinal signs on biopsy, all of them. And 66% of all of the animals in the study, so whether they were biopsied or not, that had data available, so that had history data available, also reported chronic gastrointestinal signs. So these are big numbers, 100%, like can't get bigger than that. All of the animals that were biopsied showed some evidence of gastrointestinal chronic disease on biopsy, and 2/3 of all of the animals in the study where we had data, again, showed signs that pointed towards gastrointestinal disease. So, I mean, this is quite astounding, really. And again, it makes me just think that all animals that come in for foreign body surgery, all of them need biopsies, and all of those biopsies need to be sent off. The other thing that they did was they also looked for Helicobacter from the gastric biopsies. So they looked for Helicobacter species, and almost half of the animals that were biopsied also had evidence of Helicobacter presence in those gastric samples. So Helicobacter is something that we also need to be looking for, especially from the gastric samples. So to me, this was just such a fascinating find. The study kind of obviously goes into quite a bit more detail and, you know, looks at further bits and bobs. The other thing I found really interesting about the Helicobacter presence was that presence of Helicobacter positively correlated with the severity of inflammation. So for those animals that did have Helicobacter presence, the inflammatory signs were worse, right? So there was more inflammation when Helicobacter was present. So that's something also very interesting to think about, and really interesting to think about also when it comes to treatment, right? Like if we don't look for Helicobacter and we maybe just, in inverted commas, treat for a chronic enteropathy, whether that's with a gastrointestinal steroid such as budesonide or diet or whatever else might be indicated, if we haven't looked for Helicobacter and Helicobacter is indeed present and we don't treat that, then it's still going to cause quite high levels of inflammation, certainly in the stomach. So I think that both of those things were just so interesting. And I think we just need to be thinking more about this. We absolutely need to be thinking more about routinely biopsying these foreign body cases, because I think what's really important here is if we don't get on top of the underlying chronic disease, those patients are going to represent, whether it's after 6 months or 8 months or 9 months or even 18 months. But the likelihood that they are going to come back in again for another foreign body is pretty high. And we know that, you know, multiple or repeated foreign body surgeries can lead to euthanasia. I have had quite a few cases like that where perhaps maybe sort of earlier on in my career where we had repeat offenders that, you know, kept coming in for foreign body surgery, and it just got to a point where the clients were done and they didn't want to go for yet another foreign body surgery only for it to happen again another 6 months down the line. So I think it's so important that we treat these cases well, we work them up properly. We always have GI disease at the forefront of our mind, because if we don't address that underlying problem, we're not likely to change the behavior. And this is, you know, really where sort of this integrative approach from a behavioral medicine point of view comes in, is that oftentimes these patients present to us as veterinary behaviorists for this pica behavior. You know, they're swallowing non-food items, and absolutely there may absolutely be an abnormal repetitive behavior there, but it's really important that we look for GI disease. And we have to remember that both can be present at the same time, right? We might have an underlying physical medical disease, and the animal has now learned that performing these behaviors, so, you know, eating these non-food items helps them to feel better. So it's now become a learned reinforced behavior. And now we have to come at it from both angles. So we now have to treat the underlying physical disease, and we also have to come in from a behavioral perspective and see if we need to come in there. So yeah, I just absolutely love this study, and I'm obviously going to put it in the show notes for you to have a look at. But it was just such a big eye-opener and a really actually nice piece of evidence that we should be looking for GI disease in these patients. Now, what would my recommendations be to pica cases that come my way? And in fact, I'm seeing one in August, I think, so in a few weeks, a large breed dog that is constantly chewing on and potentially ingesting non-food items. Now, we've had a preliminary physical workup. There's been nothing obvious on that. However, we might need to have that conversation about digging deeper and looking further. So how would I manage these patients? So the first thing is that we start looking into physical health, but knowing that we might need to go as far as biopsies, because we might not find that chronic GI disease unless we biopsy. And again, that's a conversation in itself, right? You know, how willing would caregivers be to go for biopsies when they're actually coming for a behavioral presentation? They think they're coming to see me for behavior, and now I'm suggesting that we take GI biopsies. So again, there's quite a lot of education and conversation that needs to be had around this. So that would be the first point, is start initiating those conversations, maybe do some initial screening, look for obvious signs of GI disease, whether that's perhaps parasites, giardia, pancreatitis, you know, any other causes of gastrointestinal discomfort. We might want to trial a hydrolyzed diet to start off with. So there are some things that can be done that aren't necessarily as invasive as biopsies, but I think, especially now after reading this paper, biopsy is always going to be at the back of my mind. So that's the first thing. The second thing, obviously, is to manage the environment, manage their contact with these items that they're perhaps highly motivated to chew on or ingest. So that would be the second thing. And then we obviously want to address the behavioral components. Whether we do that straight away or whether we wait for physical workup is going to be case dependent. I think it's going to be dependent on the caregiver, on the severity of the case, on how many times have we had foreign body issues. And if I feel that the patient might benefit from psychopharmaceutical medications or other behavior modification approaches, then I would certainly be thinking about those. Again, whether we start that straight away or whether we do things step by step is going to depend a little bit on each individual case. But yeah, that's how I would think about these. I mean, these cases are so fascinating. And I actually have a cat in Dubai who is a repeat offender from a foreign body point of view. So has had 2 foreign body surgeries in quite close succession, and is one of these cats that's highly motivated to ingest these non-food items. Rubber, I think, and foam are his preferred substrates. And unfortunately, the surgeries every time were done in Dubai, and I kind of only heard about them after the event and was not able to say, please, please, please get some biopsies. But again, it just shows that I think our protocols as a whole, as an industry, need to be better. And I think, every single foreign body surgery, unless it's perhaps an obvious play gone wrong, or unless there are obvious contraindications, we should be thinking about gastrointestinal biopsies here. Okay, so that's what I wanted to chat about here. I also wanted to just point you towards 2 things that are happening that are very exciting. One of them being a weekend workshop that I have coming up on the 2nd and 3rd of August. I'm so excited to deliver this weekend workshop. It is going to be so cool. So we're going to do 2 days, Saturday and Sunday. We're going to do 3 hours on each day. And basically the premise of the workshop is integrating veterinary behavior medicine into your everyday practice. And we're going to spend the first day talking about how that relates to sort of veterinary clinic settings. How can we relieve stress? What can we do to make the patient experience better in clinic? How do we manage these really fearful patients in the clinic? And what does it mean for our clinical outcomes? So that's going to be the first day. And then the second day, I'm really going to dive deeper into a little bit what we've spoken about here today. So this kind of correlation between physical disease and behavioral presentations. So if you'd like to join me for those 2 days, it's going to be a lot of fun. We're going to have a lot of Q&A. I want it to be really interactive. I want us to talk about cases like, this, and really sort of think about how we can come up with better ways of doing things and how we can integrate behavioral thinking into all of the cases that we see, essentially. It's only $77 so it's quite a good price. I want to have as many people come as possible. I want everybody to kind of get the chance to experience a workshop like this, because they are a lot of fun. So $77, 2nd and 3rd of August. Of course, it will be recorded. So you can absolutely get the recordings. You get access to the recordings for a full 12 months. So you can go back at your leisure and rewatch things if you wanted to. So that's my weekend workshop. And then tomorrow, the 23rd of July. So this podcast comes out on the 22nd of July. And on the 23rd of July, I have a free masterclass, which is all about creating and co-creating and designing beautiful veterinary behavior medicine treatment plans. So what are all the things I think about when I create a treatment plan for one of my behavior patients? And I'm going to use my 7M approach. And it's completely free. We've already got 100 people signed up, over 100 people signed up. So it's completely free of charge. I will again drop the link in the show notes. I'm also going to drop the link for the weekend workshop in the show notes. And I'm going to drop the link to the paper that we've spoken about in the show notes. But I would love, love, love you to come to either the free masterclass and or the weekend workshop if you want to dive deeper into some of these topics and how we can think about behavior medicine to get this really sort of holistic, integrated approach to our patients. So I hope you found today's episode useful. I just found it so fascinating when I read this paper, and, you know, yeah, just the things that we need to be thinking about. They're so complex, these cases. I hope you enjoyed the episode, and I'm really looking forward to seeing you next week and maybe tomorrow for the free masterclass, and hopefully on the 2nd and 3rd of August for the weekend workshop. All right, bye for now.